palpation of muscle around the neck. तो सबसे पहले हम डिस्कस करेंगे द मोस्ट इम्पोर्टेंट मसल ऑफ पोस्टीरियर नेक, दैट इज योर ट्रेपेजियस. और ट्रेपेजियस पाल्पेट करने का सबसे इजी मेथड है, हेयर आई हैव ऑलरेडी मार्क, कि आपको क्या करना है. आप ऐसे भी फील कर सकते हो कंप्लीट एज ऑफ द ट्रेपेजियस, बट अगर आप फील नहीं कर पा रहे हो तो सिंपल सा एक इंस्ट्रक्शन देना है पेशेंट को और सब्जेक्ट को कि जस्ट एलिवेट योर शोल्डर. यस, दिस belly is getting prominent. See, now the margin of the trapezius is clear. That is, you can follow it up to the occipital vein. Here, basically, this upper trapezius fibers are in two manner. One is horizontal and second is vertical. And here you can see that it is basically forming an angle. So, the next muscle is levator scapulae. How to identify? Basically, trapezius is used for localization. तो ये पोर्शन जहाँ पे आपका वर्टिकल फाइबर है और जहाँ पे हॉरिजॉन्टल, दोनों का जहाँ पे जंक्शन है, यहाँ पे आप अपना फिंगर पैड रखना है एंड यू हैव टू फील द edge of trapezius, then slide it in little bit anterior direction. Here I can feel the another tendon without any instruction to the patient or without the isometric contraction. You can feel the movement of my finger. See, something is slipping under my finger, but अगर आपको और ज़्यादा क्लियर करना है, then again you have to ask the patient to elevate and bring it anteriorly. Do it again and again. Yes, relax, and this tendon is getting prominent while performing. When patient is performing this movement, this tendon is getting more prominent. So this is the tendon of just anterior to the angle of trapezius. It will be your levator scapula. The next tendon is that is of scalene. Basically, there are three parts. One is anterior, medius, and posterior. So here we can palpate the another muscle, that is scalene posterior. So for that again you have to move further and see, this is already marked. It is basically the orientation of your sternocleidomastoid. I have already marked. So just posterior to the sternocleidomastoid means first you start from the angle of trapezius, you will feel the levator scapulae, then further move in little bit more anterior direction, and then apply a gentle pressure and move your thumb pad or finger pad in anteroposterior direction. I can feel another tendon, but if you are not able to feel it, then ask the patient to inhale deeply. Yes. Relax. This tendon is getting prominent while patient is inhaling. Yes, I can feel it underneath of my finger pad. Relax. The next muscle, which is used for most of the time for the localization, that is your sternocleidomastoid. So it is very simple. Just instruct the patient to side bend and rotate in opposite direction. See, it is bulging out. Relax. Do it again. Side bend and rotate. You can feel the complete force of the muscle. One fiber is oriented towards the clavicle, another is going towards the sternum. Basically, it is their attachment is basically taken from the two different parts. One is your sternal head, another is your clavicular head. So this head is getting prominent. Do it. Yes. Here you can feel a very hard muscular attachment of sternocleidomastoid. Another is here. and if you follow this muscle in upward direction, ultimately you will reach over the mastoid process. Next is the palpation of scalene anterior. We have already palpate posterior here. Anterior is found just adjacent to the sternocleidomastoid, clavicular head of the sternocleidomastoid. So you have to place your finger pad little bit lateral to this. Again, apply gentle pressure and ask the patient to inhale deeply. Yes, this tendon is moving underneath of my finger pad. Relax. Yes. So this is the location of your scalene anterior. So we have already discussed your trapezius. Second is levator scapulae. Third is your scalene posterior. Next is sternocleidomastoid, and next is scalene anterior. One more structure you can palpate here, that is your artery. Subclavian artery is found just adjacent to this area, subclavian fossa. So you can place your 2 to 3 finger over here, apply, just place it, just relax. I can feel the knocking of the subclavian artery over here. So this is the reason, and these are the structure which we can palpate in the leg.